Community Engagement Manager here at Department of Medical Assistance Services, otherwise known as DMAS. And I am here. It's normally three of us, but one is out today, so we're going to have Yolanda Chandler and or Kelly Pauley join us today to cover some of those beginning slides that we have. So if Katie can show herself, and is it going to be Kelly and Yolanda, or just Kelly or Yolanda today? Whoever is on is going to be presenting the slides. If you can come off video, if you can, and then introduce yourself, that'd be great. And then I'll go over some housekeeping rules really quickly. Is Katie here?
I'm here, but I do not have video capability. But
no worries. Go for it.
I also have my administrator in training, Derek Wiley, is here as well.
Oh, sounds good. And you didn't give us who you were and what you do, Katie.
Oh, I'm sorry. I'm Katie Reeves. I'm the administrator at Fauquier Health Rehab and Nursing Center in Warrenton.
Oh, no, I'm talking about Katie O'Connell.
Oh, sorry. Okay.
Raymond, that's okay, Katie. It's a lot of Katies in the world. I was talking about my co-host.
You're Katie.
That Katie from from DSS.
I am Katie O'Connell Raymond. I am a medical assistance program consultant with the Virginia Department of Social Services.
Thanks, Katie. My Katie. I'm sorry, Katie Reeves. All right. And then is it going to be Kelly or Yolanda presenting today? Let's see. Let me see if I can find one of them. Okay. All right. Hold on. Okay, they're not quite here yet. I'm going to go over just some ground rules, and if they don't show, then I'll just move on with the show. Kelly, okay, Kelly Pauley is on. If you can unmute yourself and just introduce yourself really quickly, that'd be great. We don't hear you, Kelly. All right. Yeah, I see you're unmuted, but we cannot hear you. All right, maybe if you go out and come back in, we'll be able to hear you. All right, we're going to keep going, and hopefully the sound issue will fix itself soon. All right, so just a couple of things as we begin. Just make sure you stay on mute if you are not speaking. Hello? Okay, just make sure you stay on mute if you are not speaking. The next thing is we really encourage you to use the question and answer portion of the platform. And if you go to the bottom right-hand corner, you'll see three little dots. And then those three little dots, if you click on them, you should normally see Q&A. We ask that you submit your questions in that format. We try to keep the chat open for open dialogue if needed, that kind of thing. If you're unable to hear, I would say go out of the platform and try to come back in, and you'll see that kind of way. Also, if you have any other comments or questions, we'll also try to make sure we get to as many questions as possible that were submitted prior in your registration as well. So let's see if we can hear her.
Okay, can you hear me now?
Yes, we can hear you.
Oh,
now.
Good. Sorry.
That's okay. If you could introduce yourself, and then we'll go ahead and start the presentation with you.
Okay, this is Kelly Pauley. I'm the Eligibility Enrollment Manager here at DMAS, and I'm happy to be with you today to try to answer some questions and present some information.
Thank you. All right, Pete, and we also like to thank everybody that helps in the background. That'd be Pete, Dahlia. I think Rebecca's not here today, but maybe Kirsten and Anita maybe. So we really thank all of the people in the background that support us while we're trying to get this done. All right, Pete, next slide, please. Thank you. And then the next one, and Kelly, you can take it away.
Okay, well, we're just going to be talking about a little bit of background and what's been going on for the past few years. This information is intended to provide just an overview. and background of this continuous coverage requirements. What the federal people have been telling us, CMS, and the plans we have to move forward. This is sort of a moving target, so we will be sharing more information as we go along, as they tell us more. Okay. To support states and promote stability of coverage during COVID-19, we were provided with a 6.2 percentage point increase in the regular Medicaid matching rate, but there were certain conditions that states had to meet in order to access this enhanced funding. DMAS has begun work to transition Medicaid members back to normal operations. And by that, we mean resuming Medicaid renewals starting in March 2023. We are collaborating with stakeholders across the Commonwealth to include sister agencies, health plans, advocates, application assisters, and providers to ensure a smooth transition for members and our partners. Next slide. And now to talk about the renewal plans. Next slide. Of course, there's a significant backlog of cases awaiting redeterminations at the end of this continuous coverage requirement. But it's important to remember that it's only a large number because we haven't been closing people within the past 3 years. Everybody is always required to be reviewed every year. So that's what we're going to be doing this year. We just got, a couple of extra million people to review. To get ready for that, we have been making systems updates to VA CMS to improve the efficiency of the renewal redetermination process. We have developed a detailed plan to stage the redeterminations, to space them out so that they're not all due at the same time. And that will always help us with next year too, to make sure you don't have some months with a very large amount of redeterminations that are needed. We're collaborating with managed care organizations to provide information and education to members after the PHE and ensure up-to-date contact information. That's been the biggest challenge, to try to make sure we can reach our members so that they can do their renewal. We've been looking at returned mail with a dedicated team so that to try to get the best addresses. We've sent out letters to them and mailings to try to get better insight into where they are. And the MCS have been helping a lot with that. We have a communications plan that includes direct member mailing, digital outreach, updates to the Cover Virginia website, eligibility worker reinforcement, application assistance, to ensure that members understand the steps they need to take, when to act, and what to do to remain covered. And we're also coordinating language approval and scheduled delivery of mailings, digital and telephone outreach, and identifying which federal flexibilities that we're going to continue with as the unwinding process continues. Next slide. CMS has given us a lot of guidance with respect to us completing full redeterminations and providing enrollees ample time to respond to requests for redetermination. So states must first attempt to redetermine eligibility based on available information. And that's what we call the ex parte process, where the individual is not contacted until we contact them to let them know that they continue to be eligible. If we're not able to do that, which we can't do with most of our ABD population, then we send a pre-populated renewal form and request additional information from the individual. Enrollees must be evaluated for other eligibility categories prior to termination and have their information shared with the state-based or federal marketplace for an eligibility determination. And we have to send an adverse action notice prior to determination, and that's giving 10 days notice at least before we close them out. We have a full 12 months to complete these redeterminations, and CMS also requires that we complete prior to termination of eligibility an additional redetermination to make sure that these individuals are not eligible for any other Medicaid group. Next slide. So this is a timeline of how these redeterminations are going to be handled. So in this month, March, we're sending out the first renewals. So that means we're doing the first ex parte runs and then sending out renewals for people who are not able to be redetermined without contact. The first time anybody can close will be April 30th. And then as we go along each month, remember that individuals have 30 days to return their renewal form, and they also have a grace period of 3 months after they're closed to turn in the renewal form or to turn in the information that we requested. After the 12 months, then we will still have a little more time to clean up in March and April next year before we return to our regular work processes in May. Next slide. So we've been working on unwinding for quite a while, like almost since this started. Of course, we had no idea that the public health emergency would extend for so long. But while we've been going on with the public health emergency and keeping people covered, then we've been working on system updates. We've been working on what the processes are going to be. We've been reaching out to our stakeholders, creating new toolkits and templates and provider memos, keeping the website updated, reaching out to our members, both with letters, but also on social media, radio campaigns, the PHE website, television coverage. We've developed trainings for the workers who are going to have to be actually doing the redetermination for all these people, because of course some of them are new and have never done renewals before. Some of the policy flexibilities have been made permanent. We have some waivers from CMS and some temporary flexibilities that we've been able to implement. Next slide. I think we're going back to you, Natalie, with this, right?
You're going back to me.
Yeah, goes over
Oh.
to Katie.
Going to Katie. Go,
From,
Katie.
From Kelly to Katie, how it should be. I'm going to reiterate a lot of what Kelly had shared earlier. This is just from the DSS or Department of Social Services perspective on what we've been doing in conjunction with DMAS to prepare for the unwinding. We've been working on a lot of communications with DMAS that have been distributed to local agencies that include information for them on the unwinding, including all affected programs. Remember, it's not just Medicaid. There are other programs that have been impacted by this as well. We've been holding joint monthly unwinding meetings. In fact, we were just talking about one that we're having next week. That's for the state and DMAS to participate with local agencies and other partners to prepare. We've helped create and update different resources, FAQs that we've gathered during this time frame, scripts, I was just looking at them, and some unwinding toolkits. There's some very good information that I'm not going to take Natalie's topic, but on the Cover Virginia website, there's some excellent unwinding toolkits that people can utilize. So we're trying to put the resources out there, scripts on what to expect. And then, working with the local agencies, giving them guidance and advice of what to expect, best practices, and how to help them clean their cases up and prepare them for renewal. Some of these cases have not been touched in 3 years. And so, what can they do to prepare for doing the renewal? And then we have a unwinding portal that's sort of a one-stop shop that's on our intranet for local agencies. And they have information about the meetings, slide decks and presentations, the Q&As that have been gathered from all the calls, going all the way back to, I think, back from the beginning of when the PHE started. Next slide, please. And so for the public, I've talked about what we're doing for local agencies, but what are we doing for the public? So Kelly mentioned some of that a little bit ago. There's a lot of social media messaging out there on different platforms such as Facebook and Twitter. I've seen it. If you go to the website that people can use to apply for essentially all programs except for auxiliary grant on Common Help, there's the web address below, commonhelp.virginia.gov. There's a banner across the top that points people in the right direction to go for more information about the unwinding. And that's been up there since November 22. And then on the VDSS public site, there's also some good information available. Very easy to find, dss.virginia.gov, sort of front and center. And then we've had joint press releases between DMAS and DSS to help with the development and prepare the public for what's about to occur. And, we were talking about helping or kind of forecasting maybe people that might lose their coverage. So we're trying to make available to them other resources that would be available. So DSS has been working with community organizations to help bridge the health gaps in healthcare. And so there's some more information on Cover Virginia. I'll give them the other shout out. But it also mentions this, the freeclinicscare.org, and then there's some very good resources on there as well, and that I poked around and looked at. Next slide, please. This is a flyer that's available, and I'm just focused on the orange column because medical assistance is my life. But this just kind of reiterates that there are other programs that were impacted between SNAP and TANF and all those other things. But primarily, we're talking about Medicaid. So if you see on the column, orange column, it gives you, and you'll see it later on in the presentation as well, it tells you the exact link to the Cover Virginia website to look at the PHE, but also go look at the DSS website that has the address right there in the very light blue banner on the bottom, dss.virginia.gov/benefit changes. A lot of good tools to help people prepare, a lot of good informational things. Next slide, please. And this is just to let you know that we have been trying to prepare our local agencies through any and all means necessary for the unwinding. As Kelly mentioned, we've had different training programs that we've developed. There's always policy training available for staff, but they specifically designed renewal training to help staff get into the process of completing renewals. We have new staff, local agencies, just like everywhere else, has experienced a high vacancy rate. So you have a lot of staff that maybe have never done a renewal, or you have veteran staff that haven't touched one since early 2020. So that specific targeted training is out there, but we're also doing subject matter expert panels where we are available from regional consultants, home office consultants, staff at DMAS, including Kelly, and some of her counterparts, and appeals, where we're answering questions for them about what can they expect during the renewal process, what might have changed, what's still the same, how can we prepare them. And so with that, we've also had monthly roundtables and meetings with local staff, stakeholders. We've been putting information out on our intranet and a listserv that goes out to local agencies or interested parties. And so our internal pages have been updated with all different kinds of procedures and awareness. And, they put together a checklist of steps that agencies can take to prepare. And so we're doing everything we can do on our side to make sure local agencies are ready for renewals. And so we just want them to be prepared. And at this point, I will turn it over to Natalie. Thank you.
Thank you so much, Katie. All right, so now you know you have a background of what each of the respective agencies is doing. But when you think about it, we're all one, right? We're Virginia Medicaid. So what does it look like? How are we making sure you have the resources and tools in order to navigate this process well? So next slide, please. So for our outreach, engagement, and communications plan, it's a three-pronged approach. You have phases 1 through 3. Phase 1 was all about updating contact information. Phase 2, we're currently in phase 2, completing the renewal process. And then the third phase is what happens if you have lost coverage. What's the next steps for that? So Pete, if you can go to the next slide, we'll talk about, like, as you go through the different stakeholder groups, you'll see that every one of you is pivotal and important in making sure that we're successful, making sure that our members not only understand what can they anticipate in this process, but how to make sure they successfully navigate it. And in the first one, foundational to everything that we do, and we say this till we're blue in the face, is to make sure that they have updated contact information. We can't do our important role and jobs. You can't do your jobs if you do not have updated contact information. So for us, it's truly important that every member knows that they have to have updated contact information in the system. As we get down the road, you'll see this plastered through all of the materials. No matter what materials you gravitate to, you will see something about making sure you have updated contact information in the system. So we encourage you to, first and foremost, make sure you have that foundational step done with your members. The next thing, and members, if you're here and you're present for whatever reason, we ask that you go ahead and take care of that step as well. Phase 2, completing any necessary paperwork that comes your way. It is coming. We had a summit last week and one of our partners rang out, the renewals are coming. And so for us, we want to make sure that everybody understands that this paperwork, if you need it, right? If you do not successfully go through ex parte, or you go through renewal for whatever other reason, as Kelly mentioned, and as Katie can mention, you want to make sure that you actually complete whatever comes your way. We want to make sure members complete that information come in their way. So this phase is all about encouraging them to do so. Also trying to make sure that we're transparent about what that process, what those steps may look like, so they can anticipate that as well as mentioned. We're making sure that all stakeholder groups are involved in phase 1 and in 2, because all of you are pivotal in our success in getting this done. Now, when you get to phase 3, which is making sure that if we have members that have lost coverage due to administrative reasons, that we encourage them to go back, complete it, do what you're supposed to do. Or if we need to transition you because you've had a wonderful life event, you got promotion, you got a new job, right? You're no longer in the pool of people that need Medicaid in this way, right? Or you may be able to qualify for coverage in a different kind of way. We want to celebrate that, but we also want to make sure you have the information that you need in order to get there. And so phase 3 is all about making sure if you've lost coverage or you need redirection for whatever reason, we're able to provide that to you as far as other resources that are available for coverage. This is primarily going to involve our health plans and our marketplace navigators, but it doesn't mean that you as a stakeholder in doing whatever you're doing regarding nursing facilities can't help and redirect them if they need to some of those resources. Next slide, please, Pete. Thank you. So what have we accomplished so far? What have we done? So for as far as member outreach and engagement, some of the things that we've done for members and stakeholders are the same. You'll see the toolkit development has been the same for both, because we understand that in order for you to feel comfortable and confident in doing this work, you need to have some kind of guide. And so we wanted to make sure you had that information at your disposal. So you'll see that in both. But for our members, we've made sure that we've created for our stakeholders use is digital ad campaigns, social media campaigns, making sure we update the copy and language that exists on our websites, that we make sure we redirect any of our other websites, whether they be internal, which as far as our DMAS, or from our sister organizations, which is like BDSS, redirect them back to Cover Virginia so that our members as well as our stakeholders are all on the same page about that information. We've also mailed member flyers and posters to our local Department of Social Services offices, as well as our community service offices, community service board offices, so that they will have something to tangibly hand out to our members as needed. They are always open to order more beyond what we send them, and translated documents into 6 other languages outside of English. And that's trying to make sure that we make that you as a member and that our members as a whole have access to that information however they need to. Our stakeholders get memos, they get informed information. Our health plans have all the information that they need. They have been wonderful partners in this process and making sure that they consume that information, ask really poignant and relevant questions along the way so they can feel that they can be successful as well. And we've held virtual and in-person meetings with our community partners, our navigators, our advocates, our organizations, anybody and everybody that has asked for us to be there, we have been there. So we want to make sure that we continue to do these things. And lastly, we're having these town halls, right? We have these spaces, this dedicated space for you to ask questions, for you to engage, for you to sit there and go, hey, I think I thought about this, but I'm not quite sure. And to be in the company of others that may be thinking similarly. Next slide, please. All right, so what do we have for you to use? We have stakeholder toolkits. We have phases 1 through 3. Phase 1 toolkit is what you'll see with the orange bar, and then phase 2 and 3 is what you'll see with the green. In the first toolkit is all focused on what does it mean to update your contact information, and the second toolkit is all about making sure that they complete that renewal packet and what to do if you are to be celebrated and you have moved on from the need of health insurance with Medicaid, but you may need some assistance elsewhere. If you go to the Cover Virginia website, at the very top, you'll see a return to normal enrollment web page, and you click on that, and then there along the right-hand side, you'll see toolkits and materials. So we encourage you to definitely use these resources. Next slide, please. Thanks, Pete. So one of the things that's in there that we're really excited about is a toolkit use of the process flow chart. We try to demonstrate to the best of our ability. It's a simplification of the process. We know that there's nuances to the process in of itself. We know it can be complex in other places, but we wanted to make sure everybody understand what's the responsibility of Virginia Medicaid, and that includes everybody in the ecosystem, right? That includes us, that includes BDSS, that includes MCOs, that includes stakeholders, that includes everybody, right? What is the responsibility of us? And then what is the responsibility of the member? If the member is in that place in the process, they're like, I'm not understanding what's taking place next. They can take a review of this and say, oh, it is now with Virginia Medicaid. And the next time they send me something, they're going to be waiting until I send that back or they respond to it. So it's a really helpful tool, and it's available for you to download as well as to order. Next slide. So we also have flyers and posters, and they're gorgeous. We got a chance to see them last week. They're very bright and colorful. They definitely draw your eye. And so we want you to order them. We want you to use them. We want you to pass them out to your members so they have a firm understanding of what's taking place. We also encourage you to sit down with your members as you can and kind of review that information so they stay well informed. As you can see, these are the 6 other languages that the information is translated into. The English and Spanish are available for ordering. If you need it in any other language, that is definitely available, but as a download. Next slide. So as you can see, we have been plowing through these town halls, and we are at our 6th one. Isn't that amazing, Katie? Like, we've gone through this so many times, and so we really are excited about the number of people we've been able to reach through this avenue and just listen and understand what your questions are. And actually, we're about to get to that segment where we get to answer some of those questions. We have one more for right now. You know, we are always in a space of providing support and need. So, you know, if our deputies are like, hey, we need to have another one, we'll be ready. We have everything we need. But for right now, the last one that is scheduled as of today is this evening at 6 o'clock, and we open it up to all stakeholders and our members. And so we encourage you to attend if you've signed up. All right, next slide. So what are our takeaways? What is the main things we want you to remember, right? Medicare renewals will begin in March, right? They're beginning this month. It is not happening in some abstract time period along the way. Some of our members will start to get renewal packages early, I believe it's next week. And so we want to make sure that you have a firm understanding and you're confident in this process, right? We want to make sure that you feel like you're at one with us and trying to get this information to our members. The next thing we really want you to understand is this is a staggered approach. This is a 12-month process. Not everybody's going to go through with renewals at the same time. And because everybody is not going to go through renewals at the same time, we need to make sure everybody is equipped and understand that, hey, first and foremost, you need to have your contact information updated so that when Virginia Medicaid actually reaches out to members, that they receive that information and they can respond in a timely manner. How can you support Virginia Medicaid? First and foremost, can I say it again? Make sure they have updated contact information. You're probably going to hear a lot of that from our subject matter experts today. The next thing is if they receive a packet that you actually support them in getting it done successfully. And it's a number of different ways you can do that. I think on the next slide, where I'll kind of review the different steps they can do in order to renew that packet. We want to make sure that they can do that because it doesn't have to be with you. Not all of us are, like Kelly Polly and knows all things that have to do with that application. And so we want to make sure we tap into those resources as we know they exist and provide additional feedback to us. If you find that there's a gap area, there's additional resource or tools, send it to us for consideration because you may not be the only stakeholder that needs it. And so we want to make sure that if we can create it and create this process so that it's not only easy for you, but ultimately easier for our members, we want to make sure we support that. Next slide. So here's the way. Here's the different ways that you can actually help to renew coverage. First and foremost, you can call Cover Virginia. If anybody has ever had the pleasure of calling our call center, they are wonderful and helpful people. They stand ready to answer any questions, to navigate members as they need to in order to successfully complete what they need to, where they need to. We have online common help information, and Katie will talk about that as much as you would like about what that process looks like, how they can access it, but making sure that, if they want to understand what's there, what's taking place, when things will take place, they can always tap into common help. The last thing is in person. And, I always take a point of privilege to say here that make sure we create and we provide grace and space and mercy for these team members who will be receiving our members to help them along in this process. They are doing the very best that they can with all the resources they have at their disposal. Katie alluded to earlier that they're going to have a lot of different things that they're both learning but doing sometimes for the first time. And so having a little grace for them as they're going through that process is always helpful. And making sure that when you reach out to them, they're prepared with all the necessary information in order for them to actually be successful. We would also encourage you to visit our website at covervirginia.org. Actually, we have a new website. It's quite beautiful. We encourage you to go there so that you can see it and navigate it. But always, if you need the information, go to the Return to Normal enrollment page. Next slide. So thank you for coming today. We're going to step into a space of answering questions. We try to make sure we have a good amount of space to do that. So before we get started, I want to make sure I know all of my subject matter experts that are going to be here today. We already have Katie here. We already have Kelly here. Is Ann here today? No, she may not be. She is here today?
I saw her log in, yes.
So her login, if she can come off mute and introduce herself and any other person that will be helping to answer any questions today from DSS or from DMAS, please by all means come off mute, introduce yourself, and then we'll jump right into question. Oh, nobody else? Okay. Well, if it's only going to be you two, then let's jump right in. All right. So if you lose coverage, or for some reason, you lose coverage according to the time. Well, first and foremost, before we go there, Kelly, could you explain the timeline for returning the information once they receive it? How much notice they get if they do not get a chance to return that information, and then what's the period of time they have to come back to Medicaid if they've lost it?
Sure. If you get a renewal form, the pre-filled renewal form, then you have 30 days to turn it back in. If more information is needed after we get the renewal form, then you have 10 days to send that information back. Where the form goes depends on what address we have on record as the individual's mailing address. Someone's asking, will the facility get it? It just depends on what the address is. So if you wanted to reach out to all the authorized representatives and power of attorneys and all the people who belong to your people, that would probably be a good idea. So once the agency gets all the information back in, they're supposed to process the renewal within 30 days. And then the individual will get another notice that states whether their coverage continues. If the individual does not turn in everything within the time frames and they end up being closed, then they still have 3 months to either return the form or to return the information that was requested. If everything then is okay, the coverage will go back and fill in that whole period of time, and there'll be no gap in coverage. Is that everything you asked me, Natalie?
It was, Kelly. I thank you.
Okay.
The next question, well, we have multiple questions, and I don't know who this will be directed at, but multiple questions about over resources. So if a resident is still over resources, how long would they have to spend down that money? Will the residents have been allowed as far as different kind of maintenances? Can someone kind of review what over resources, how those over resources will be handled during this time period?
Yeah, let me talk a little bit about that. So what happens is any of the payments that were made from the government for COVID during this time frame, those are all exempt, and they're exempt forever. So we are determining how much the payments were and when they were sent out, so that we can provide that information to the workers so that they will know and they will assume that money that is in the individual's bank account includes that money. So that money is exempted forever. In addition, if for some reason they did not pay patient pay that might have been obligated in a normal time, for instance, if they had a medical bill and then and it was adjusted for, but then the worker could not increase the patient pay to get rid of the medical bill, that money would be considered something that the worker can exempt. So the worker will look at the resources, they will look at the prior patient pay and see whether, like, did the person go from community-based care to a nursing facility? Usually that would mean that their patient pay would increase, but during the public health emergency, it couldn't. So during that time frame, if the worker can show that the money that's in that account is a result of the individual being allowed to keep money that usually would have been obligated to patient pay, then the worker determines what that amount is and puts that into our system to exempt that resource. That resource will then be exempted for 12 months until the next renewal. During that 12 months, they can spend that money on anything they want to. If they don't have a burial plan, they can get a new contract. They can put money aside for burial. They can buy a TV for their room. They can get new furniture. They can spend their money on anything they want to spend it on. What they can't do is just give it away. So they will be asked at the next renewal, what happened to this money that we exempted? And so they should be ready to show what they did with the money. Hopefully at that point, 12 months later, so, a year and a half from now, they will then be resource eligible. If they are not, or if they're not resource eligible this year when they have their renewal, then what will happen is that they will be closed. They will have at least 10 days notice, and they will, then they would spend their money on their care until their resources went down below the limit and they could reapply. But that's the last alternative. We hope that we're going to be able to get resources below so that we can tell what their current situation is. How many months is the needed bank statement for renewal? You just need the most recent bank statement. When you're doing your renewal this year, can excess resources be placed in an Able Now account? If the person's eligible to have an Able Now account, yes, they can put their money in there.
All right, we got more questions. I think this one may be a Katie one before we pop back over. In preparation to resume Medicaid renewals, we have some people that have been trying to link Medicaid cases through Common Help, and they have not been able to be successful. When they call for assistance, they are told that the client needs to call and the eligibility worker. What's the process? What's the best way or the best process they need to follow in order to assist those clients?
If they are trying to link their case in Common Help, and are having difficulties and have to contact the local agency. And I keep beating this dead horse. Know that unless you're listed as an authorized representative, the local agency won't be able to speak to you. It's like calling Social Security. They're not going to talk to you unless they're authorized to. So you have to have the customer with you to give their verbal consent or have something on file with the local agency, and they can tell you the case number. But generally, to link it, they need their case number. And you might be able to link it by your recipient ID number. I'm not sure. I'll have to play around with that. But I would reach out to the local agency to make sure you're using the correct case number.
Thank you. Kelly, I think you touched on this a little bit before, but I just want to make sure it's re-emphasized. When it comes to the allowable amounts for members as it goes towards, the redetermination or renewal process, where can they find additional information about what those allowables are?
We are finalizing a ABD long-term care services and supports fact sheet that will list out some more of those things that are able to be for the money to be spent on. And so that will be available on the website. And if someone is closed for excess resources, it will be sent out to those people too. I see someone had asked, what about the COLA increases? One of the CMS rules is that we still can't take negative action on a case until the renewal has been done. So, so we can't just start raising the patient pay without doing the renewal. So we can't even do the COLA increases until the renewal has been done.
Okay.
And somebody said, if the resource overage is from the occurrence of patient pay, how can you do that with one bank statement? You're not figuring that out from a bank statement. You're figuring that out from the history of the case. In the case, the worker will be able to look at when something happened. Like if they look at the case notes, they can see when something happened that would have resulted in the patient pay being raised. Or they may have had to override the case to keep the patient pay at a lower amount or send in a correction. So that's how they're going to determine and document whether we can put those resources aside and not count them.
Sounds good. And Katie, will any excess resources have a negative impact on SNAP renewals?
I am not a SNAP expert, but they changed SNAP policy last year a little bit to make more people categorically eligible. So you'd see more aged and disabled people that you would think would be over the resource limit. So it's hard to say. There is some guidance on the Common Help website that you can plug and play to see if they remain eligible, but I'm not the person to talk to about SNAP.
Hey, Natalie, this is Elizabeth. Could I just say something real quick? Elizabeth Smith from Integrated Care.
Actually, we're taking questions only in a written format.
Okay,
So
this
we
isn't
try
a
to make
question.
sure we have space for our subject matter experts to answer any questions. So if you could place your comment in that space, we would greatly appreciate it.
Sure.
Thank you. All right, so we mentioned an Able Now account and people are like, what is that? So Kelly, is that a question you can answer?
I think Katie put in the chat the link to what the Able Now account is.
Perfect, thank you. And this infamous question that we get frequently, will renewal dates be available in MMIS?
And we've been told that they are going to put those in the portal. But I don't, the one where you check eligibility now, someone said, what is this portal? But I don't know when that's supposed to happen, but I know that there have been change requests for that to happen. If someone needs medical equipment and wants to purchase it, that is absolutely fine. If a provider submits a patient pay adjustment, will they ignore it? I don't think that they will ignore it. If it's an adjustment that would reduce the patient pay, they're supposed to go right ahead and reduce the patient pay, just as they have been doing during the whole public health emergency. If it's a request that would increase it, they would have to do a renewal first. And our advice to the agencies is not to trigger those renewals early, but if they decide for whatever reason that they need to do it, they can trigger the renewal to send out the renewal forms, and then they could increase the patient pay.
Thank you so much. And I don't know what these mean, but maybe you can help me. Someone is asking, how will unwinding and the renewal process affect ICF/IID homes in Virginia? Can someone touch that? No? All right, we'll have to
I would
follow up.
think-
Hey, this is Ann.
Okay,
Sorry.
hey, Ann.
So individuals in ICFs also go through eligibility determinations. I would presume that it does touch them. So they would just fall into the normal cycle, just like any other regular fee-for-service recipient. If that's what they're asking, I'm not exactly sure if that's exactly what they're asking. So if not,
Well, they
please
just
put it
asked
the
in
chat,
general,
we
how
can
will it
follow up.
affect them? And so I think in general, you've answered that question. If they have more specifics, they can drop it in the chat and we'll try to circle
Right.
back to it. Thank you, Ann. And Ann, do you want to introduce yourself in your title as well?
Hey, it's Ann Bevan. I am the Division Director for High Needs Supports, which oversees the DD waivers, housing, employment, brain injury services, and ICFs.
Thank you so much, Ann. All right, so another question that's come through is, can case managers have been unable to really give answers on previous cases that said they will be adjusted later, and now some of those cases are being closed due to expiration, so they say. They're holding a credit, waiting on adjustments for patient pay and insurance. Does anyone know what they can do in order to accommodate for those adjustments or to navigate those adjustments?
If those cases are closing for other reasons, you don't need to hold it. We're not going to be going back and trying to do any sort of recoupment on things that happened during the PHE. We're not going to be going back and trying to do the old COLA increases. We're not doing any of that. So, for instance, if someone has died, my understanding from your provider manual is that you are supposed to give the contents of the patient fund account to the estate within 30 days. We're not going to be making these patient pay changes in the past, so you shouldn't have to worry about that. There's a question on here about, will patient pay be entered for those who have no patient pay info on the website? If someone has no patient pay info on the website, but you have been getting paid, then that probably means that they are a Magi adult, and so they don't get a zero patient pay. They just don't have patient pay. If you have a new person who has no patient pay info, you may need to send a 225 to the worker to say, hey, are you aware this person's in the nursing facility, so that they can calculate the patient pay.
Thank you, Kelly. And could you explain what covered groups will be going through renewals during this time? Is it everybody or certain ones? Who is going actually through this process?
It's everybody.
That was a
It's
simple one.
everybody. Over the course of the next
Everybody.
year, everybody will be renewed.
Thank you so much. And during this renewal process, will anything change regarding any of these particular covered groups?
No.
No.
I
Thank
mean,
you.
we have
Same covered
to redo renewals on everyone. The only thing that we have changed is that we are going to maybe be able to do ex parte renewals on some facility patients if they have SSI only income and no resources on file. So for that tiny little group, they may go through an ex parte renewal where they didn't before, but otherwise, everybody goes through ex parte, but most people who have any kind of resources get dropped out and sent a form.
Sounds good. And could you kind of go through, because we got a couple of questions about renewal dates, would the renewal dates look similar to what they had before, or should they be expecting a new renewal date?
I think most of them are the same. The only ones that none of the first set are being moved. Is that right, Katie? You've gotten the new list, right?
That's right. I mean, the ones that they're starting with, we're starting obviously with May current and then a portion of the backlog. And so that backlog will be parceled out over the next 12 months.
Right.
Sounds good. And you may have touched this one already, but I want to make sure I ask. How quickly will residents get their Medicaid back once they finish spending down the money they had to hold on to because they could not get liability amounts during COVID? Will it still take 45 days or will it be fast tracked?
I do not think that it will be fast tracked unless the local agency has the capacity to do that. I think they will go through the regular application process. Is that right, Katie?
That's correct. There is no expedited Medicaid unless someone is pregnant or breast cancer. They get 10-day processing if information is correct. But if someone loses their coverage and has to reapply, it's a 45-day time frame. If they have all the information that's required. So local agencies do their best to get them done before that, but sometimes it's at that date. And we'll see what happens.
Okay. And okay, so this one is a bit of a shift, but how do people handle large credit balances of residents who have passed? Who should refunds be sent to?
My understanding is that those refunds are due to the estate.
All right. Will there be new renewal forms or will they look the same as before?
They're the same as before.
Okay. And where can they find that information?
I think that the renewal form is going to be posted on Cover Virginia, but keep in mind that it's a sample. You want to print that out and complete it because everyone will receive a pre-filled renewal form with the information that's already on file.
Yes, and I would also say that we are working feverishly to make sure that the updated one is available for ordering pretty soon. So we hope to have that available by April 1st so that everybody is good there. And let's see, we did have a comment about the SNAP card alerts in the spam,
Right.
that
I've
gone
gotten
on
that
before.
too.
Yeah, so Katie, do you want to give a disclaimer about that? Or Kelly, if you want to give a disclaimer, we definitely had information up on Cover Virginia about making sure that everybody watch out for scams and making sure they do not fall prey to them. But I heard that Commissioner Avula also emphasized what to do, additional information about what happens if you have been, a victim of those scams.
I think I've read some of the information about the SNAP skimming and scamming, and local agencies have been directed, what procedures to take if someone contacts them.
Mm-hmm.
I haven't seen the alerts myself, but I've seen the communications about it.
Is it a general mailbox that they can get in contact with Katie at VDSS if they have any additional questions about that?
I believe there is. Let me look very quickly.
Okay. All right. Let's see. All right. As we go through that, I just want to give time for our SMEs. I think we were able to answer a vast majority of the questions. They're very similar in that regard. And for ones we weren't able to get to, we'll make sure we fold into the very large FAQ document that is going to be available as a result of all of these town halls. You all had wonderful questions, very specific questions, and we want to make sure that we get to those things. I'm going to give our subject matter experts an opportunity to have a last word, a parting gift, as they like to do, as far as making sure you remember. And so I'll start first with Katie, and then we'll go around. And if we have any sneaky questions that come up that I think will be really good for the body, I'll make sure I bring those up as well. So I'll start with you, Katie.
My dead horse that I like to beat a lot and that we keep talking about is make sure that people have the right address. There was a question asked earlier about where would the renewals be sent, and Kelly stated it's the mailing address that the local agency has on file. So that could be a POA or an authorized rep. I see some people from nursing facilities on here that I recall from my prior lifetime. If it goes to the nursing facility, please remember that if you're not an authorized rep or have that capability for the customer, that you have to have their permission to complete the renewal form. The local agency also will not give you any information without being an authorized representative. The only means we have to communicate with a nursing facility or other providers is through a 225. And on that, we can only tell you that they were approved, they were denied. We can't tell you the patient pay because that's in the portal. So we really have to have some clarification of who we can speak to because of HIPAA. And with that, I like to advocate, from having just come back from the other side, please make sure you send a 225 if somebody's receiving care. Because with the pandemic, we had people that we would enroll based off of a screening, where generally they would only have 30 days to find a provider and start care, or they'd be reevaluated, but they've been allowed to go on for 3 years. So we want to make sure that local agencies are aware that there's a provider, so when their renewal comes due, they're not trying to scramble making sure that the person is getting care. So that's my biggest thing. Know that they've gotten it. Also tell them to check their mail. I get mail and put it on a table and look at it a month later. That wouldn't work if I was getting a Medicaid review. So just putting that out there.
Thank you so much, Katie. Kelly, any parting words or final thoughts that people need to keep in mind as they're trying to make sure they navigate this process successfully?
Yes, people are asking again about the stimulus payments. The stimulus payments are exempt forever. If for some reason you get someone and they don't have full coverage, like they've come into your facility and they don't have full coverage, send another 225 to the agency, because as Katie said, they may not have reevaluated them. If they were in expansion during the public health emergency, but now they're ABD, we will be evaluating them as ABD when the renewal comes up. And the only resources that qualify for this 12-month exemption is if it is money that otherwise would have been obligated for patient pay. That could be for someone who was expansion and didn't have a responsibility for patient pay and they just kept all their money in an account. Yes, that could qualify for the exemption. So documentation is going to be really important for that. And but if you have people who are not on full coverage that are in your facility, you need to send another 225 now.
Thank you, Kelly. And any parting words from you?
Nope. Address. Because that will
Make sure
affect
your
it. If they
updated
can't,
address
if
is there.
Medicaid gets terminated, the provider's authorization gets terminated. So we don't want y'all to have to go through that. Thank you.
You're welcome. Well, as always, we thank you for joining us. We are so excited to have you along this journey with us. We understand that it comes with a little bit of complication and complexity, but we also understand that you are hungry for information. We will be providing the finalized FAQ probably in the next couple of weeks after this final town hall, in order to make sure everybody has the questions there, that we have everybody answered them and review them as necessary. We'll make sure we answer with that. You can always go back to any of the previously recorded sessions. They have lots of wonderful questions that were answered during that time as well. So please, we encourage you to go back and review them. We also encourage you to take the time to breathe and think to yourself, what are the wonderful ways in which, what are the outcomes that we're looking for? We have a wonderful director that always reminds us at the end of the day, none of us would be here if it was not for our members. And if we can make this process as smooth and easy for them as possible, we will. And for us, we know that we can't do that without having engaged and happy stakeholders. And so we want to make sure that you all get what you need so that you can serve our members to the best of your ability and they can continue to have access to quality health insurance, whether that is with us or someone else. So we thank you for joining us today. We thank you for your time, your energy, your resource. We thank you for all the things that you have, will continue to do. We thank you for all of those things. So you have a wonderful day. Come back, reread, and we should have all of that information up on our website in the next couple of weeks. Please take advantage of all the resources. Have a wonderful day, everybody. Thanks again for joining.